The consultation starts by discussing your goals and desired outcomes, including any reference photos you may have. Your overall health and medical history will be evaluated, and photos and measurements will be taken. You'll need to share any past surgeries, medical conditions, or medications you're currently taking. Based on this information, the surgeon will recommend a procedure and explain the details, including the surgical technique, anesthesia, and location. They'll also discuss the risks, benefits, and potential complications. Recovery expectations, including timeline, discomfort, and post-operative care, will be outlined. You'll also learn when to expect final results and schedule follow-up appointments.
Hello, could you please introduce yourself and tell us what surgery you're performing today?
Hey, I'm Daniel. So today I will be getting a face and neck lift with a little bit of under the chin lipo and a little bit of a sub-brow lift to remove some of the kind of excess tissue under my eyes.
Facelifting, a cosmetic procedure that counters aging by restoring elasticity and fat, making you look younger. Neck lifting, also known as lower rhytidectomy, this procedure addresses wrinkles and sagging necks, enhancing a youthful appearance. Chin liposuction involves removing small amounts of fat through a cannula, resulting in a smoother profile and less fat under the chin. Sub-brow lift involves an incision under the eyebrow to remove excess skin and muscles, reducing sagging without altering the double eyelid crease.
Right. And what made you to come to Korea to perform the surgery?
Well, it has a great reputation for plastic surgery around the world. I was coming to Korea for work, actually, and I decided to tack on this trip also in order to get this procedure done.
Great. So far, you've done the consultation and you're doing the surgery today. How was the process?
So far, the process has been really, really easy. So, really clear, simple communication. I know where I need to go, I know what I need to do, so it's overall been very pleasant and very headache-free.
Great. I know you're kind of nervous at the moment, but try to relax as much as you can. We'll see you soon.
Before we continue, please visit answerplasticsurgery.com for more information. Photos for before and after comparisons will be taken. Before the surgery, Dr. Choi Min revisits Daniel's facial aesthetic goals to ensure the procedure will be smooth and accurate. After the surgery, Dr. Choi Min checks the patient and explains the details of the procedure that Daniel underwent. After the surgery, there will be follow-up checkups. During these visits, the clinic staff will assist in cleaning and sanitizing the surgery areas to prevent infections. Dr. Choi Min checks on how the patient is doing. Daniel undergoes red light therapy to support his recovery. This treatment helps reduce swelling and inflammation, accelerates healing, alleviates pain, and improves the appearance of scarring. After 7 days, stitches from the surgery areas will be removed. Photos were taken again for the before and after comparison. Small patch of bandages were placed on the areas where the stitches are removed. Remaining stitches were removed.
Hello.
Hey, how's it going?
Hey, today was your last appointment. We removed all the stitches and now you're good to go.
Yes.
Could you please explain to us how the process was?
Overall, the process was really, really smooth. So the post-care was really comprehensive and excellent. I knew when I needed to go, what needed to happen, so on and so forth. So it was very painless. Yeah, the whole process from start to finish.
That's great. Could you please tell us what was most discomfort or what was the most painful thing throughout the after the surgery?
There really wasn't much pain, really. It was, I felt swollen but it didn't actually hurt necessarily. Probably the most difficult part was, since I had a subbrow lift, I had a lot of swelling around my eyes.
Yes.
And I no longer had peripheral vision.
Okay.
So like I had to turn in order to see things rather than
Right.
being able to rotate my eyes. So that was not problematic, but annoying more than anything. Truthfully, probably the worst part of the whole experience was that stupid compression garment that I had to wear for the week after. That was unpleasant, but mostly because it was a little bit itchy, but it didn't hurt or anything.
Okay.
Yeah.
So we know you're still swollen and have a lot of bruises left since it's only been a week after the surgery.
Yep.
But so far, are you happy with the result?
Yeah, very much so. So I asked for a really subtle change in my upper eye, and I've already seen that kind of happen, even with a little bit of residual swelling. So very happy with that. We looked at some before and after photos after 1 week yesterday, and so I had a lower face and neck lift, and I could definitely see a much more acute kind of cervical angle in there, which is what I was going for. So overall, it was, it's only been a week, but I'm quite happy with the results so far.
That's good. Final question, would you recommend the plastic surgery to other people?
Yes, I think so. I mean, if it's something that's bothering you and you have the means to do something about it, why not? So I think so.
Thank you. Yes, we wish you all the best for your future. And if you have any further questions or concerns, feel free to ask us at any time. And have a safe flight back to your home country.
Fantastic. Thank you so much.
Thank you.